What does burnout actually look like in hospitality? Burnout is about feeling emotionally, physically, and mentally exhausted from excessive and cumulative demand experienced at work and across your wider stress profile. Burnout affects anyone, and hospitality employees are particularly susceptible to it. So, more specifically, picture the scene. A head chef, 15 years in the industry, loves the work, prides themselves on never taking a sick day. Then, one morning, they just can't get out of bed. They're not physically ill, there's just nothing. There's no feeling, no motivation, no version of themselves that wants to go into work. That's not a bad day, that's just burnout proper. And it didn't start that morning. So the World Health Organization defines burnout as an occupational phenomenon characterized by three dimensions. There is exhaustion, which is the depletion of physical and emotional resources, cynicism and depersonalization, where here we're talking about emotional detachment from the work and other areas of one's life, and of course the people in it. And then there is reduced professional efficacy, which is that feeling that you're not good at this anymore, that nothing you do makes a difference. It's not a character flaw, it's not a weakness, it's an insidious, cumulative, and predictable clinical response to a specific set of conditions that persist over time without relief, and that's burnout. So, exhaustion is the first stage. Most leaders identify it and would probably refer to it as tiredness. Cynicism is the second. Watch for the staff members who used to love their work and now talk about it with a sense of detachment or contempt. That's a clinical warning sign, not an attitude problem. Reduced efficacy is the last and the third stage, and is a really complex and difficult stage to recover from. It's essentially when someone stops believing they're capable of doing their job. Now here's the part that catches most leaders out. Your highest performers are efficient burnout maskers. They mask burnout the longest, most effectively, and most efficiently. They've built an identity around coping, and by the time it shows, it's been building for months. So there's that insidious, cumulative nature of burnout again. Burnout should be seen as a signal. When someone burns out, the question isn't what's wrong with them. The question is what in how we work has contributed to this person over time developing burnout. Burnout is a psychosocial hazard, but it also tells us so much about the overall system and identifies other psychosocial hazards in the workplace. These might include irregular hours, emotional labor, poor recognition, high physical demand. These are structural features evident in the hospitality sector, which means burnout prevention isn't just an HR issue. It's about operations, and in fact, it's everyone's responsibility. Leader actions should and could include starting a regular monthly check-in with each of your managers. This is not a performance review, it's simply a one-on-one where perhaps two questions are put to the person. How are you actually going? How are you actually going? And is there anything about work that's been grinding you down? The idea obviously being to catch burnout in its early stages before it becomes a crisis. Again, watch for the cynicism signals. If someone who used to care starts talking about the work or customers with contempt or detachment, that's your warning sign. Have a private conversation. No need to label anything, just ask what's going on. After every peak season or extended busy period, build in a deliberate recovery period, lighter rosters for a week, a team lunch, genuine acknowledgement of what the team has just got through. Recovery is not a reward, and it shouldn't be. It's prevention. Map your rosters against the last 3 months. Identify which staff have consistently carried the bulk of the load. Prioritize them for check-in and recovery first. And you probably already know who they are. Burnout in hospitality is almost entirely predictable. It's real. The conditions that cause it are within leaders' control. You don't need to wait until someone hits the wall, so start watching for it earlier.